Hello and welcome to our conversation today. Campaign for the Culture, Beyond Pride, Overcoming Barriers to Health Equity for the LGBTQI plus community. My name is Lincoln Mundy, and I have the privilege of serving as moderator during this conversation. But before we dive in, I'm going to first provide some context about myself, this conversation series, and the experts that we've convened here today. I hope you can see my shirt. It says Support Queer Liberation, which I feel like is a great introduction to myself and what I'm about. My career has been focused on young people, specifically LGBTQI plus and Black youth. Whether it's films like Black Lives, Black Lungs, or narrative campaigns that led Advocates for Youth, or strategies I've worked with national organizations on focused on LGBTQ health and rights. It's always been focused on the communities that I hold sacred, which include the Black community, the LGBTQI plus community, the rural community, and all the intersections and overlapping layers in between. That's why I was so excited when my friends at CTFK invited me to help guide this conversation, because even though I'm a part of the LGBTQI plus community, my work in this space has really been focused on the disproportionate impact of commercial tobacco on Black communities. So I have a lot to learn, and I'm excited that we have the space and the time to really talk about the barriers, but also the opportunities for our community. Now, if you're new and this is your first Campaign for the Culture, welcome. If you've been along the ride, so many other series, you know that this is laser focused on uniting, empowering, educating, and engaging people of color and other targeted communities around intersection of tobacco use. Understanding that we are layered, we are intersectional, and we need to be in conversation with experts and advocates and young people about these issues. Today's specifically event will focus on highlighting the health inequities that LGBTQI plus communities face while gathering the solutions from those who have been at the forefront of this fight. So speaking of, let's introduce those people who have been at the forefront of this fight. Public health providers, experts, and advocates we've assembled today to be in conversation with us. First up is Dr. Monique Gary, Medical Director at Grandview Health in Pennsylvania. Welcome, Dr. Gary.
Good afternoon. Thanks for having me. Great to see you.
Of course. Next, we have James Husband, Health Equity Coordinator with the Louisiana Campaign for Tobacco-Free Living. Thanks for joining us, James.
Everyone.
Adding to our conversation today will be Dr. Scout, Executive Director at the National LGBT Cancer Network.
Hey, it's great to see you, Lincoln, as always, and everybody else.
I love your bow tie. And I'm excited to welcome Yesenia, Program Coordinator of Transgender Services at Boston Healthcare for the Homeless, to round out this terrific panel. Welcome.
Thank you for having me. Thank you.
Beautiful, beautiful. So thank you all for joining us today. I'm super excited to learn more about your work and everything that you've been really focused on regarding the LGBTQI plus communities. Just sort of grounding for me in this conversation is that something that I found when making my first film 8 years ago, Black Lives, Black Lungs, that really stayed with people is really a balance of faces to facts, really. Yes, understanding the lived experiences of people who've been impacted by systems or issues, while also being grounded in the facts that we have at our disposal to leverage for change, whether it's in our communities, at the state level, at the national level. So if you allow me, I want to ground us first before we get into the conversation on two facts that I want to help guide our conversation. The first one is that according to the 2021 National Health Interview Survey, NHIS, 15.3% of LGB adults are current smokers, compared to 11.4% of heterosexual adults. Another stat that can help guide us is that we also know that LGBTQ plus adults are more likely to use e-cigarettes than heterosexual adults, with a stat showing that in 2021, 13% of LGBTQ plus adults reported current use of e-cigarettes, compared to 4% of their heterosexual counterparts. So those are two facts that hopefully will help guide us in the reality of what the LGBTQI plus communities are facing. And with that, I'd really sort of want to get back to the faces. I want to get to know who you all are. And I think a question that I would love to hear from each of you is, how has your identity as an LGBTQI plus community member influenced your understanding of our unique health challenges? And what if we start with Dr. Gary?
Thanks so much for the question and for allowing me to participate in this amazing dialogue. And, wherever we go, there we are. And you said it, that our intersecting personalities and identities are really what creates a uniqueness and a richness for us, but also can create some challenges. And as a lesbian woman, in the healthcare system, I have faced, even as a healthcare provider, I've faced bias. I have faced challenges in accessing equitable care. And I feel like, it's important for me to be visible and to highlight those challenges that I've had, whether it's in reproductive or whether it's in preventive spaces, whether it's having the conversations and checking the boxes on just the basic healthcare needs. And if I have those challenges as a person of privilege, as a person, with a medical degree, as a person with access, what challenges am I seeing in my community that are going unaddressed? And so it's important for me, when I speak out and go into communities, to recognize that point of privilege, but also the fact that everybody doesn't have those unique opportunities. And so a lot of my work centers on going into our communities in the Philadelphia and surrounding area and highlighting the lived experience and letting people know that they're seen and that they're represented, because that representation matters, not just as a Black woman, but as a Black queer woman. And when they see me, they understand that I'm going to help them advocate for the care that they need, and that I understand the systems that are in place and the way it feels to be a queer person accessing healthcare in America. So it definitely influences my understanding of the challenges, makes me more sensitive to it, and it lights a fire under me. It's my why, and I wouldn't have it any other way.
Thank you so much. And I'm just really grateful for all the young people and just everyone who have the privilege of getting to be seen by you, really, and probably seeing themselves in you. And that's really, really what I think about when I think about representation. So thank you for sharing. What about you, Yesenia? How does your identity show up in the way you do the work?
Yeah, I actually sympathize with a lot of what was already shared. I'm a Mexican non-binary first generation person in the United States. And I will be completely honest, I feel like I learned a lot of what the healthcare industry is, like the systems that are very difficult to understand, at my place of work. So it is incredibly humbling and challenging to learn a system that is very inaccessible to many, and help others who may be immigrants themselves, who might not speak English, who are queer or gender expansive, overcome that fear. Also, as someone who has experience of medical trauma, I do feel like I can leverage my lived experience to help empower folks to be strong self-advocates, and also just overcome fear that may present in a doctor's office or in front of a therapist. Some of my work has a lot to do with the processes of obtaining therapy letters and medical letters to be able to obtain gender affirming care. And that process in and of itself can be very frustrating and time consuming and takes a lot of self-advocacy. So that just, my own personal experience has helped me, yes, feel passionate about the work, and also help and continue to empower youth and adults alike.
Beautiful. What I heard in that is that like lived experience is expertise, right? And I just feel like that really goes to the theme of tonight of Beyond Pride, because you're talking about how these lived experiences can be then empowered into advocacy and policy change. So thank you so much for highlighting that. How about you, James?
Hey, I really want to echo what Yesenia said and Dr. Gary said already a little bit, and touched on just kind of lived experience and being able to show up to your community and say, hey, look, I'm a part of your community, and I'm, I have privilege and access to this knowledge that I learned during my experiences in accessing healthcare. As a transgender male and as a person who is cis-passing and white, I recognize the amount of privilege and power that I have in the spaces that I work in public health. And I try and do my best of taking that privilege and that power and leveraging it and amplifying folks who have different experiences and have more intersectional identities, and thus have more needs. I really identify with the lived experience and recognizing what issues I had with access. And if I have issues with access as a person who has a lot of things going for me, and a lot of privilege, then I know that for other folks who have different identities and more intersecting identities, that access is more limited and that health impact is felt more deeply. So I do my best to show up and be able to echo the voices who need the most. And I aim to work myself out of a job and get people to be the healthiest that they can be.
Hear, hear. What a mission. I retweet that. Thank you for sharing. Hey, Dr. Scott. I can obviously, being executive director of the National LGBT Cancer Network, it's obviously sort of intertwined, but I'd love to hear from you. How did your identity show up for you in this work in terms of influencing?
Yeah, that's a great question, because we all usually are really deeply committed to this because of our own experiences. Like, I remember back when I was in queer youth groups and I would see people smoking, and then I was leading queer youth groups and I would still see people going out to smoke all the time. And then I move on to like my first cancer screening. It took me 2 days to heal when the providers found out I was queer, because they were that rough with me. And then I moved forward to, I was able to go for a PhD, and my thesis was on social determinants of transgender health. And that really opened my eyes to the idea of how privileged I was in the trans communities. And there are so many people who are struggling to get to adulthood, to survive through adulthood, and just in the face of such incredible hostility, that I feel a great responsibility to open as many doors as I can, get into as many new places as I can. When I first got my PhD, I was one of 2 openly trans researchers, health researchers around the country. And that's ridiculous that there are so few of us out there. Luckily, that's changing now because of a lot of other people's hard work. But that just means that there's a lot of us who aren't getting the chances to be everything we want to be. And often it's because of health interruptions and challenges that we have, and the extra stigma and discrimination that we also experience. So I'm on a mission to try and change it as much as I can, as long as I can.
Yes. And I just want to note, you said, thanks to the work of others. And I also want to honor your work included in that, right? And sort of that trajectory of hopefully getting so much more representation in all fields, academia, the public health space, and at large. So thank you for your contributions as well. And thank you to everyone for really sharing how you show up in this conversation, because I think it's so important to really, hard on the issues, soft on the people, right? Really build community with each other and conversations with each other where we can have dialogue. And so I appreciate you for being open and sharing how your identity comes up in the work. And now I want to get a little closer to some of those solutions oriented, right? And I want to ask James to get us started with really just sort of, I would love to hear from you. How does stigma and discrimination to you contribute to tobacco use in the LGBTQI community? And then from that solutions-oriented lens, how can we combat it?
Yeah, absolutely. So I have the privilege to have connected with a researcher who lives down here. So for context for folks, I live in Louisiana, I live in New Orleans in the Deep South. And our local researcher did research around stigma and the queer identity and how that affects smoking and nicotine dependence. And she focused on Louisiana, Alabama, Mississippi, Georgia, and South Carolina. And to take her expansive research and really boil it down into like 2 seconds, she found that queer stigma and internalized homophobia and stress, particularly general stress and minority stress. So like minority stress is stress that folks who have intersecting minority identities will tend to smoke more to combat that stress and alleviate that stress. So that answered the first part of your question, which was like kind of what are we seeing with minority folks and stigma and smoking. Your second part was like, what can we do to combat that? That's correct. Yeah.
Correct. Yeah.
Okay.
How can we combat that trend?
Great. So I think a big thing that me and my mentor and my peers talk about is looking at our community representation. So looking at our community advisory board, really looking at the demographics, and also like allowing our community advisory board partners to share their identities and describe their identities, how they show up, and on the back end as data collectors, going through that and figuring out that when people's identities aren't, in one particular box, how can we recognize them? So not making people choose male, female, or other, but letting people choose the way that they're actually represented and the way that they see themselves, and going on the back end and identifying those gaps and seeing who's at the table, and making sure that whoever isn't at the table, that we connect with them in an authentic way.
Yeah, and I really appreciate that note on research, because sort of we don't know what we don't know, right? And having accurate research and accurate sort of like options for people to identify with themselves is important, especially for our space. So thank you for bringing that in. I'd love to go to Dr. Gary, because you have sort of a unique perch in sort of the healthcare industry. A lot of us work around it, adjacent to it, but you obviously work directly with people on their healthcare journeys holistically, and you also sort of exist in a system that some of us are not inside of. So from your expertise, I would love to hear sort of what are the disparities around accessibility and service and delivery when it comes to the LGBTQI plus community in healthcare.
Boy, you said it, right? In access, in delivery, in service, and in outcomes. So when you look at it from the entire continuum, it starts at preventive practices, right? Where are people accessing their care to even get things like, cancer risk reduction and screenings? And there are barriers there. The studies show, and a lot of this work comes from the work of our illustrious panelist, Dr. Scout, right? So much of queer folks in our communities are utilizing urgent cares, or utilizing emergency departments for routine preventive things, or their routine preventive care has fallen to the wayside because of structural racism, let's call it, structural bias, structural components that really hinder our ability to access and utilize care. So the disparity exists, and where I stand in the oncologic space is I watch what these statistics are doing. And thank God someone has begun to really collect that data. And like I said, much of that has come from the work of Scout. But when you look at what the risks are for things like, lung cancer, James mentioned the numbers of smokers, right, in young adults in Louisiana. And you look at the numbers in adults, and it mirrors that, right? So probably 33% of queer adults smoke, which is 68% higher than the rest of the general population of cis het folks who, then we look at the lung cancer rates, and that concomitant increases there. Rates of screening for things like mammograms and cervical cancer, 50% less chance of getting screened, whether it's a doctor didn't refer you or whether you didn't present to a center to get that screening done. And what does that translate into? The disparity translates into the inequity, right? Because now you see the higher rates of things like breast and cervical cancer, and things that we consider to be really preventable cancers. And so I think we have our work cut out for us. I know we're going to talk a little bit more about sort of the mindset and wellness and all the things that go into risk reduction, but it starts with, understanding and measuring those metrics. It starts with looking at where people are accessing care and bringing that care to those communities, because when people have to travel to get to that care, and then they go there and we realize that, okay, I don't feel welcome in this space, or, oh, this was the office where, someone told my partner XYZ, they don't go back. And so we have a lot of work to do to make our spaces more affirming and to bring care into communities. And there's some good models for what that can look like. So I'm looking forward to talking more about that. But the disparities are there, especially from an oncologic standpoint, because pretty much everything that reduces chronic and preventable illness can reduce the risk for cancer. And everything that increases the risk for chronic illnesses, hypertension, coronary artery disease, diabetes, stroke, all that stuff increases the risk for cancer as well. So, cancer is sort of along that continuum where we hope things don't get there, but all these conversations as we talk about these health behaviors, they result in cancer.
Thank you, Dr. Gary, and thank you for bringing up the wellness and the mental health aspect of it, because I want to get into that, and I want to ask Yesenia specifically, sort of if you could share what are some of the main mental health challenges that LGBTQI plus youth face in terms of well-being, and solutions oriented. How can communities better support them?
Yeah, so I will say that we see a lot of folks experiencing homelessness who are trans and gender expansive at Boston Healthcare for the Homeless program and in the greater Boston area, including youth. And I think something that I'm trained as a clinician as well, and I think something to acknowledge is that trans and gender self-consciousness has a relationship with self-esteem, and the variations in socialization are going to produce different outcomes in youth identity and self-consciousness. So I think one is combating bias around gender and sexual variation, as well as mental health services. I think youth and adults alike think that accessing a mental health specialist, a clinician, a therapist is done when somebody is in crisis, or in general other types of biases, and that's actually not the case at all. Could you remind me the second part of your question?
Yeah, of course. It's just like, what supports or what policy recommendations do you have for communities to better support LGBTQI youth who may be facing houselessness or mental health crises?
Yeah, I think as a program, we communicate and partner with other organizations that are specific to trans and sexual minorities, whether it be Bagley or Mass Trans Political Coalition. But in general, I think that we should all be doing the work to combat bias and stigma around trans and gender variants, not being complicit and saying that's not my area of expertise, let somebody else do it. I think the purpose of, for example, our transgender team at Boston Healthcare for the Homeless program is not to own all of the knowledge around gender affirming care. It's really to be teachers and leaders and build up others. And also, I think where we mentioned earlier is engaging our consumers to have a voice, because it's a dialectical approach in education and healthcare, in every field. It's a dialectical approach because the youth know a lot more about gender variance than I do. There's new things happening every day, and they definitely teach me more than I can teach them.
I could read literally anything you write. Yeah, like I could listen to you for days. I think yes on not saying this, so that's not my lane. I feel like yes I really relate to that. So my queerness, but also my Blackness, especially sort of the rise of EDI initiatives where that's sort of like that is siloed and this is siloed. And so I really appreciate you bringing that in. And also listen and engage and resource young people. That's most of my career. And if I could go into every nonprofit or every organization and just say, listen to more young people, resource, pay them more to help structure your strategies. Don't have a strategy without young people at the table. I think that would be my sort of like my mission. So thank you for bringing that into the room. To round us out, I would love for Dr. Scout to share some context, especially in light of all of the horrific legal, I'm just going to legal everything, right? Just like oppressive system structures, laws that are not only criminalizing queerness and transness, but also empowering and encouraging other people to criminalize and other people to sort of have this bounty hunter role, which is just very terrifying. But I would love for you to share, like, how can we actually, obviously everyone has lanes, but how in public health, like how can our space or sort of any actors really show up, and what policies could be enacted to actually improve the mental health and physical health of LGBTQI people?
It's a great question. And yeah, absolutely. As you talk about, it is a horrific environment right now. According to several historians, we're several steps along the scale of genocide against trans people in the United States, to the point where like Canada will now give us asylum simply for being queer in the United States because it's so hostile. If people aren't familiar, there's been over 500 laws at the state level, legislative actions against queer people, mostly against trans youth, just this year alone. And you're absolutely right, Lincoln, that is putting incredible pressure on our youth. And kind of going back to something that you were talking with James about too, about, what's going on with some of this, this excess burden of smoking. The age that we come out on average is 13. The age of smoking initiation is 13. So unfortunately, by the time we often get into this game of trying to figure out what to do, we're aiming at people who are already kind of too late, and they're already pretty deeply in the throes of addiction. And we know that these laws, we just had information coming out of Florida that 80% of the trans people in Florida are trying to leave the state because they do not think they can get their needs met in that state. But also we're talking with people on the ground, and the level of suicidality, the level of stress and trauma. So I think one of our biggest dangers as you talk about what we can do is that, I work a lot in the cancer field. And we've got all these cancer organizations over here being like, well, we work on cancer. Well, over here, there's a legislative problem with queer folks. Those don't really overlap, or we work on tobacco. Here's a legislative attack on queer folks. Those don't really overlap. They do. This is creating the stress that is going to absolutely seed the next generation of smokers. This is absolutely one of the driving reasons behind we see higher use of e-cigarettes and all those flavored e-cigarettes for the youth, cherry starburst flavored e-cigarettes, things like that, in our communities across all of the different, intersecting identities in our communities. So what we can do is see these connections, stop acting like they're silos, stop acting like you can work on a health issue that may be like cancer. You're like, okay, it's mostly a later in life health issue. Yeah, but if we're not going to even survive to that point because of the level of stress that we're experiencing, we are right now, unfortunately, the bad actors are causing a huge amount of in-community trauma. And we know that we go to these negative coping mechanisms in order to deal with it. So, if you're not going to speak up now for a population that's under this level of attack, when will you? So I encourage everybody to think beyond the silos of whatever your specific health issue might be, and go back to these earlier in life antecedents, because right now, queer youth are absolutely under attack. Queer adults are still feeling under attack. So we need to have more of that soft landing for those 13-year-olds when they're coming out. Where do they go to feel welcome? If we don't have enough of that around us, get to your high school, start a GSA, intervene. You can help make it a softer landing.
Literally just retweet everything that you said. I think that is exactly it. I hear you talking about breaking up in silos. I hear you talking about not ignoring the overlapping issues. And I think just a personal point of context is that I studied and did a lot of research on how commercial tobacco infiltrated the Black community with festivals and the Cool Jazz Festival, right? And like political ties. And I did all that research around the 80s and the 90s, right? To go to a Pride festival in like 2018 and for it to be sponsored by a tobacco company. And I think it was just so visceral that it's sort of all interconnected and it's all intertwined in the same strategies, the same tactics that this industry uses against Black Americans with menthol is specifically sort of the same playbook they use with all targeted groups and all the marginalized.
And they're getting more aggressive. The last few years, they have spun it up. And unfortunately, some of our under-resourced organizations are saying, sure, we'll take some money because we don't have enough resources. But that means that their twisted health messages suddenly come from our trusted organizations.
Let's go into it because I'm like ready to dive. So what can you share examples of the ways the tobacco industry has targeted the LGBTQI plus community, Dr. Scott?
Oh, we got stuff going all the way back to the 90s. And, I remember way back there was a huge community leader. He helped me in the 1993 Civil March on Washington, but he was also advising the tobacco industry how to use their messages in our community to get us to be more responsive because we were pretty resistant to their message. So he's like, yeah, talk about hands off our bodies, things like that. And they took that stuff and then they went out and, like you say, they found all of our festivals. They started to twist some of the messages and get them in our festivals. We keep running across people again and again. We're kind of a little bit like an iceberg right below the surface. Suddenly the tobacco industry is there. We run into bars where they are contractually not allowed to do any tobacco control work at bars. We go to media outlets that are taking tobacco stuff and we're like, please stop. And they're like, we would fold if we didn't have this additional money. But then like just 2 years ago, there was a big thing on Capitol Hill talking about the Equality Act, civil rights for all of us. We need it. sponsored by the tobacco industry. And that isn't even where they stopped. I've run into people at conferences that are not admitting they're from the tobacco industry. You just find out because their stuff is too slick and too pat. And next thing you know, you look up and you're like, oh yeah, they were sponsored by the tobacco industry. And then this last spring, we've had someone from the Vaping Industry Association go around to all of our leaders, offer money, offer sparkle, offer all the things we need. And in exchange, all we've got to do is kind of take some of their twisted health messages, like, you know, vaping is really the harm reduction we need. Ignore what it's doing to the youth, but queer people need it. And suddenly they're introduced into our community, not by the tobacco industry, but by the front people that they've invested in. So you always got to be careful about, if you're hearing those tobacco industry messages, you're like, wait a second, where did it come from? Because I doubt it was really the community leaders who thought that. It was probably the result of a tobacco industry investment in our leaders.
Call it like it is. James, I'd love to hear from you, sort of, given this sort of predatory marketing that Dr. Scout just describes, given this sort of investment and the outcomes that we know comes from that, what strategies have been proven successful in decreasing tobacco use among LGBTQI individuals, and how can these approaches be scaled up, do you think?
Yeah, so I think kind of taking their strategy that they've used and using it back and like adapting it to visually like not just visually, but like visually show representation of our communities. I know that my previous field of work was HIV, and I know a lot of folks were seeing that, some movement around that of like having authentic community representation, even in some areas, having people from that community being not just represented and like being a part of their marketing, but also being paid to be part of their marketing. So we're seeing like local drag queens or queer folks or LGBT community leaders who are recognizable in these communities being worked with. And so I think Yesenia kind of like sort of described that effort as well, as like tapping those folks who are considered experts, who have social capital and value to local communities, working with them on a messaging that is reflective of those communities, paying those folks. And then a big piece that I really talk about a lot, because you know, I live in New Orleans, we're kind of a blueberry in our state, is recognizing that your queer communities and LGBTQI plus communities, those communities will be different across different areas. So a queer person in New Orleans might not look, both dress wise and visually, right, like outward, visually look the same as a queer person in rural Louisiana. And that's like really important. I think that some folks kind of forget or tend to gloss over when they build marketing campaigns or look for like kind of a one size all fits solution, is that your communities, and not just queer communities, right, Black and Brown and Latinx communities as well, those will all be different in different areas of your state, and really putting in that extra work and time and authentic time of like networking with those different pockets of communities across your area is really important. And then like kind of the last thing I'll say to wrap up is that a lot of, I've noticed with queer communities, is that the further you go out, and Scout, Dr. Scout kind of mentioned this too around resources, is a lot of these community organizers need money, and a lot of times nonprofit structure money is not the most convenient way to be able to redistribute. Sometimes money's tied up in a grant, just first off, and then sometimes if it is a grant, it's restricted funding. Sometimes it's tied in a grant, restricted funding, and all of these things. And it's just tough to redistribute from a nonprofit perspective. Sometimes it's tough to redistribute money to these grassroots organizations, and that can be hard to combat. And so just community representation, visual representation, recognizing they're not a monolith, and doing your best to leverage your power and resources to get those into communities so they can use it for their priorities and their needs.
Yes, I'm hearing multi-year funding, general operating, longer-term support, investments, resources to all of my funder friends and communities. Yes, 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 retweet. Dr. Garrett, I'd love to hear how this is sitting for you, just sort of like from a physician's point of view.
You know, the missing piece here in all of this is the clinical input and the trust, right? Because all of these sort of interventions and campaigns that are designed to help reduce risk, that are designed to decrease harm, that are designed to help us understand the health implications of these. The physician's rep in all this is pretty flimsy right now, right? Like we've seen it even, before COVID. I mean, when you think about, especially as a Black person, the very first introduction to a physician in this nation was on a slave ship to keep us alive long enough to sell at the block, right? And then when you look at our role in things like conversion therapy, it's outlawed in 20 states. There's no laws in 23, and 16,000 kids between 13 and 17 are going to receive conversion therapy in states that haven't banned it yet. We're complicit in that as physicians, and I think that the lack of partnership and trust and transparency amidst all of these wonderful campaigns, it hinders us because we really need to get involved in this work if we're going to help people to get screened and to get into preventive practices and to be participants actively in their healthcare and make sure that the care is equitable and utilized. But the docs are silent. And, they too have had a role. Scout, you can probably weigh in on this, but when you talk about cigarette campaigns, right? Let's talk about prescription drug use. Let's talk about all the ways that, that degree and that code has been used to do some pretty harmful things. And so we have to call in the words of my dear friend, Ricky Fairley, our baby's ugly. And as an industry and as a profession, I think we need to own that and not only own our role in it, but approach it with some humility and desire to partner in these spaces, because the clinicians are always woefully absent from these conversations.
And thank you for being present in these conversations, first of all. But I think you just illuminated, I've worked in reproductive justice and sort of this space and LGBTQ health and rights. And I just imagine so many of the state, local, national campaigns that would have been supercharged if there was that clinician participation, trust, engagement, right? I just think of all sort of the resources that could have been opened up by that sort of like cross-sector collaboration. And I take it as a charge to figure out ways in my life to have that connection. But I do hope that there's more people like you who are really working and being thoughtful on how to make this connection, because the baby is ugly. There is such a long decorated, sometimes celebrated history of the medical industry harming Black communities, Latinx communities, people in Puerto Rico, like queer, like just everywhere. And so I think it's important to start trying to build some of that trust back and power sharing back with clinicians who get it and who are understanding as to the holistic health. Yesenia, I want to bring you into the conversation about sort of like, as your role, obviously working more local and with your community, like how is this sitting for you? And maybe what is something that you would like to partake to those listening?
I'm not sure, but I did want to share something. And talking about this entire conversation is, as Dr. Gary mentioned about physicians, it's the same thing with clinicians, is that we also have a very not great trusting relationship with folks who are trans and non-binary. And I will say something that I've just been thinking that's been sitting with me is that social researchers, we're engaging with a lot of stats, which is great, but social researchers often conflate sexuality and gender and even intersex people when doing research, and it's not the same. So I guess I hope that we all just like say it with our chest, say what we mean.
Yes, I think we should all have a group agreement. Say it with your chest, say it with what we mean. Kind is clear. Yes, Dr. Scott?
I was just going to say, related to what Dr. Mo was talking about, she is so right on the money that this is actually getting worse right now related to some of the physician stuff, because just this week, right-wing physician organization launched a new website about conversion therapy, encouraging conversion therapy. And the name of the website is specifically modeled after the actual Pediatric Medical Association. So that's like something that's just literally happened, but we're seeing this go around the country. For example, a little bit, we were so excited the Department of Health in Florida was sponsoring their Tobacco Free Florida program, was sponsoring one of the prides. So exciting, right? But like half a year later, Department of Health for Florida comes out with an advisement around trans youth care that, ignores places like the American Medical Association or the American Academy of Pediatrics, which is really the association of professionals, and instead quotes the Catholic Medical Association to show that trans care must be bad. So unfortunately, we have to be even more educated these days, but we have to start youth how to also be more educated, because the amount of misinformation coming from physicians that is just echoing out right-wing positions is similar to the misinformation coming out from the tobacco industry pretending like it's health.
100%, because that, as soon as you said the fake name of the website, it's just intentionally misleading, and it reminds me of all the names the tobacco industry has used, like the Tobacco Research Independent Committee, which wasn't independent, right? Like, it is just the same playbook, and I think this group here gets it, and I think so many people get it, of the intersections and the layers, because just seeing how these strategies are similar coming at us, I think is helpful to grow together. I'm grateful for all of the reality and sort of the legal aspects that have been brought up, the sort of healthcare aspects that have been brought up, but I want to think more a bit about wellness and about sort of outside of systems. And I think, Dr. Gary, I'd love to start with you, and then everyone else can chime in. But Dr. Gary, I was really excited when I was doing, my little research on the group. I was excited to learn about Still Rise Farm and really your sort of holistic approach. So I'd love if you could share more about Still Rise and really why it's important to connect the mind, the body, and the spirit to promote wellness.
Sure thing. Thanks for asking that and giving me an opportunity to talk about it. Still Rise Farm, we call it a living learning laboratory because it becomes the training ground for folks to come and figure out what wellness looks like and feels like for them, because it's not as prescriptive as I think people would like for it to seem, especially on social media. It just seems like, okay, do some goat yoga and, eat some sea moss and, take 2 of these, tablets and, the mushroom coffee, and there you go, right? You've arrived at wellness, and it hasn't seemed, 1, accessible, 2, realistic, 3, affordable, right? And then from a cultural standpoint, it just has not, I would say that the inclusion of intersecting queer culture with wellness has been somewhat absent from social media and from marketing and from funding, right, for resources for folks to come out. So Still Rise Farms is 40 acres. We're in Upper Bucks County, Pennsylvania, which is certainly not the most diverse area. Let me tell you, it's in farm country, PA. One of my patients calls it Pennsyltucky. And we are we're queering up Pennsyltucky out here by really providing a space where we learn about food as medicine, where we can figure out what feels good to our bodies for movement, whether it's yoga, stretch, mindfulness, qigong, and all of the different modalities. Our main crop right now is wellness, not just because it's fall and we don't have any crops, but also because if that's the only seed we plant. That's the one thing we want to grow. So it really stems from a philosophy that you've got to figure it out for yourself. And it is a welcoming space for those, especially facing cancer and chronic illness, but for marginalized communities, for our queer community. We're starting to do fun things like training community navigators and helping to record the lived experiences of folks who have gone through the health systems, especially in Philly, but really helping people by being visible, by recording those stories, by making sure that, people can realize and reach out to folks who look like them and have shared lived experience. Say, you know what, I got that breast biopsy. I got that mammogram. I did that low dose chest CT, and here's how it went. I went to a therapist, right? And this was my experience. And here, let me help you along on your journey because it's okay. And so demystifying and breaking apart some of those stigmas. So that's what we're all about. And we'd love to see all of you come out to it as we have more events and more programming, but it's what's necessary because stress is killing us. Our own Surgeon General has indicated that isolation, stress, depression, mental health impacts every single system in our bodies. Right. And what great mental health and mental distress are we under as a queer community under attack? And so I think that the influence and the impact of mental health and self-care and wellness on our community would reap dividends, not just from a cancer standpoint, but all along and all throughout the continuum of healthcare. And so I'm excited to see that revolution and to see groups have those discussions. And we're here for it. We are literally here for it.
I can like imagine it as you speak about it, and like it's the only seed we choose to grow is just so powerful. And I am so thankful for spaces like this, because a lot of time people literally just need physical space, right? Like physical space to like lounge, relax, not have an agenda, right? And a lot of people want, and sometimes ourselves, we want to sort of like structure it or like theorize it, right? But sometimes we just need to lay on grass, lay in a hammock.
Yeah, absolutely.
I love that. Thank you for sharing. And I'm definitely going to check out Still Rise later on. Anyone want to add anything about the wellness sort of aspect of this conversation we're talking about LGBTQI communities?
I'll just say that I think it's really important for everybody out there, if you care about social justice in any way, understand that particularly our kids are not all right now. And do not presume, even adults, in the queer communities are doing okay at this point. So, if you've got just a little bit extra hospitality, support, dinner, whatever it might be, to reach out, and it's really a time to offer it, because we need to move. We're unfortunately very much stuck in survival mode, and we need to move to wellness mode. But that means we need a lot more social supports. We need a lot more social opportunities, particularly for those youth who aren't yet connected with community members who might normalize their experience. They're getting a lot of negativity in the news. They're getting a lot of it in school. So if you've got folks in your family, whether you've got like a nibbling, a younger generation, something like that, or if you've just got folks your friends, anything like that, reach out and do more, because I know a lot of adults who are really not okay right now. And that's is really concerning because of what that means for our youth. And so we need to get to wellness, but we're still struggling with survival, even more so in recent years.
Definitely agree. And there's liberation and moving from surviving to thriving. And that's also the road that I am on with you all. Yesenia, talking about sort of wellness and sort of these outcomes for LGBTQI individuals, especially young people, given that you're a clinician, like, why do you think it's important to address the social determinants of health when we're talking about some of these issues that may seem siloed?
Yeah, I think in the clinical setting and in research, I think addressing social determinants of health is really seeing a problem in its totality. And I think I come from a background of being a case manager. So if anyone has been a case manager or done any kind of direct service, you know that you can't address housing needs without addressing food insecurity, without addressing substance use disorders and everything in between. And it's the same if you do like public health work or population health work. It's hard to tackle a problem if you don't understand all of the intersecting problems that someone might be experiencing. I think specific to transgender health, for example, in Massachusetts, we have a health law solidarity network because although I work in healthcare, it's hard for me to keep up with all the legislative changes and impacts or health insurance. I work in healthcare. That's not the same as health insurance. I have no idea. So I think creating conversations between all our law, medical, education is important to, first of all, understand populations. So if it's city level or for me, folks who are living in shelters, I think that's step one. Just doing like a biopsychosocial of a population before really and having conversations, hard conversations. People really enjoy doing focus groups. They have a lot to say. We just had a focus group on the trans experience in shelters, the good, the bad, the ugly, everything, and people have a lot to say.
And we need to listen, and those experiences should be participatory. And so I'm really grateful to have people like you, sure, in the field for a long time from now, supporting that work. So I'd like to get sort of um, Dr. Gary's take on how we can ensure that healthcare services are equally accessible to LGBTQI communities. Like, what are some of the policies or practices that we can get sort of equity for our community?
Well, I think the first thing is really, again, going back to this sort of concept of cultural humility, right? Right, recognizing that trust is not guaranteed; it has to be earned. And when you hear statistics like 65% of gynecologists are uncomfortable screening transgender patients, you realize that there's some systems problems that are even beyond, structural things like racism. Like, there's a lot of implicit bias and explicit bias in our health system right now that impairs our ability to provide equitable care, even when those physicians and clinicians are in those communities, right? Like, it's not always about, oh, you can't get to one or you don't have access. It's like, no, you don't want to go there because you know what happens when people go there and how you get treated. And so I think recognizing that there's a lot of work for us to do as medical societies and as clinicians and physicians to really make sure that we're providing training. And I can tell you that, the medical students and trainees are hungry for more information. They're hungry to figure out how to implement this type of inclusivity and belonging in archaic systems that haven't always welcomed it. Because we end up training our trainees and they go into these hospitals ready to, kick some ass, and like they can't because the culture doesn't support it. And so we've got a lot of work to do to make sure that we're providing a culture of safety and a culture of inclusivity and belonging for queer individuals who want to get care, and making sure that we're provided just a safe space for queer clinicians and physicians and residents. And like, can we start with that, right? We can't expect patients to have a transformative experience if we've not had a transformative healthcare experience. So I think there's that. I think also meeting people where they are and doing things like at the high level, decentralizing clinical trials and collecting data and just sort of getting the demographic data, because what matters and what changes is what we measure. And so looking at those metrics to see how are we doing with, reporting and screening and providing this care. And when we're doing poorly, not necessarily penalizing those systems, because what happens is the systems that are doing great continue to get more funding, and the ones that are struggling but providing the care to the communities that need it the most may get penalized. And so I think it can't be a punitive system, but it really needs to be a comprehensive look at how we're doing in these communities and what can we do better with smart goals and demonstrable things and all engagement among all stakeholders, right? Like, our queer community should be at that table. We should be having those conversations about initiatives that are going to impact them, because if we sit in our bubble, in our ivory tower, and we come up with these great things, they're not going to work because we haven't included the people who are impacted by them. So I think inclusivity, I think measurable metrics, training community health workers, and really just getting involved and showing up as a medical community is going to help to answer your question, which is kind of ensuring that the care becomes more accessible and more widely adopted.
Yes, and here's to a culture of safety and culture of care and culture of space for queer physicians, for queer patients, for everyone. I love that. James, I want to get a little bit more granular on your experience. What are some effective strategies for reducing healthcare outcomes among different segments of our community?
Yeah, I just real quick want to echo what Dr. Gary said and Yesenia about social determinants of health and the culture, and to answer your question too. So what can we do to reduce disparities amongst populations? Is that correct? Yeah.
Correct. Like different
Okay.
segments of the LGBTQI community.
Different segments. Okay. Thank you for repeating that. I really not to rework the words that Dr. Gary said, but I really want to highlight the culture aspect of a community health center, not just the physical location as well. Physical location, bus accessibility, subway, metros. We don't have those here. They sound lovely. They're really great. But like public transportation, and when I talked earlier about with grant funding and stuff, like make it easy for community organizations to pay for bus tokens or metro cards, also like the culture of an organization. I have a lot of great peers and LGBT and trans trainer peers, where like the culture starts at the top in your C-suite, excuse me, and trickles down to your front desk staff. Like I know there are a ton of free toolkits and resources and amazing things that all of us have. We could probably name like 5 different ones from different organizations. But the hard part is, as a leader and as a manager and as a peer, whether you're in charge of people or whether you're not in charge of people, it is producing that culture of these people matter. Whether it is LGBTQI folks, whether it is Black folks, whether it's brown, right, all the different intersections and identities of people that exist. It is part and imperative that people go, these people matter to me, and you check your peers and hold them accountable that this is the culture of our workplace. If the culture of your workplace and organization is not one for those communities, it's going to reflect that way. And community members are smart. They're going to know, and they're not going to show up. And so like that is like not the easiest answer in practice and doing, but it is a very important answer of making sure that you build a culture of caring and emotion. And then you can add the tools like back of house data collection, where you can let people self-identify and then go into the spreadsheets and figure it out. You know, training your front desk staff that, you know, whoever the person is, you want to ask them their name and like their pronouns, you know, and you want to make sure however these people show up to your organization for whatever services you provide, you show up to them, serve them compassionately, emotionally, and for what their needs are, and break out of silos. Like that is a huge thing.
Yes, I think that's the theme of our conversation, to get out of our silos, understand it's layered. So thank you for bringing that in. I'd love to really end us on one of the recent wins we've had, right? There's a lot of work to do. I'm grateful that we have you in this space, each of you as a group, collectively, all of us doing that work, but I also want to acknowledge some of the wins that we've had. And I think for a question for Dr. Scout is, of course, you know that my film, Black Lives, Black Lungs, really exclusively focuses on how the tobacco industry successfully infiltrated the Black community with menthol products through philanthropic ties, through political donations, through predatory marketing, and thus the impact of. And so I'd love to hear, now that we're at this time where menthol is likely to be eliminated by the Biden administration by the end of the year, what does that mean for LGBTQI health?
I think it's a great opportunity. As you demonstrated so well in your film, obviously menthol is just a flavor. It is the last flavor allowable in combustible cigarettes, wildly disproportionately used by the Black communities. It is racist that the one flavor that is wildly disproportionately used is still allowed. That is absolutely, that was a win by the wrong people, right? But now the right folks are actually kind of getting there. So don't listen to some of the myths. This will not affect an end user whatsoever. This is only about producers and sellers. And what we know when things like this happen is it puts friction into the experience of people who are smoking cigarettes. And that friction is often a point, because almost everybody who smokes is trying to quit, right? Is trying to actually get away from that addiction. That friction is often a jump point where they can move to complete cessation. So first of all, we're going to have a whole bunch of people in our communities disproportionately using menthol, who are going to have that potential for a jump point. And more of the quit lines and all these cessation organizations are doing a lot so that they can be very queer welcoming. So I encourage you, whether it's calling or texting 1-800-QUIT-NOW, to use those cessation resources instead of flipping over to a non-menthol cigarette. But most importantly, about the youth, we know that menthol makes it easier to start, harder to quit. We did a financial analysis a little while ago and found out that our communities are spending over $2 billion on combustible cigarettes a year alone. If we were to invest that money in our own community infrastructure, we would have all those mental health supports that we're saying we want, right? So this is going to be a break point once menthol is banned, that easier to start and harder to quit is no longer going to be accessible to our youth. The ones where we know you move from e-cigarettes over to combustible cigarettes. We've seen the evidence on that. And so we don't want to make that path simple and easy. Getting rid of menthol, the flavor that makes it simpler to do that, is going to be one solid step forward, so that a whole bunch of people who might decide left or right are just going to be like, nope, not the addiction path. I'm going to go the other path completely instead. So it's a big opportunity. But we have a lot of misinformation that's going to be flying around even more heavily as the tobacco industry. I mean, sadly, a report just came out again by one of our community organizations supporting tobacco industry talking points. So we've got to be careful as that information comes out. Who are we listening to? Places like the NAACP, 100 queer organizations have all stood behind the idea of get rid of menthol. We need it for our youth and for our communities. It's past due time to do it.
Here, here, past due time, and I'm really excited about that end of year. So thank you, Dr. Scout, and thank you, everyone, for such a rich and lush and open conversation. I would just like to share one thing I learned from each of you. Dr. Gary, I learned around the urgent care usage, or the trend in urgent care usage for LGBTQI communities, and all I saw was price tags, and so I just want to learn more and know more about that, and I see it so clearly. Yesenia, I learned from you around how trans and gender expansive consciousness is connected to self-esteem, which obviously is supportive of mental health and well-being, and how we need to be more holistic in our approach, especially to young people. So thank you. For James, I learned for you, culture of charity, it starts with the C-suite to the front desk, and that you have to really get your back of house in order before you focus maybe also on external things. Scout, from you, I learned that we need to check on our people. It's trying times, overlapping pandemics, overlapping isms, and so it's really important to check on our people. And I also learned to check our references and information around misinformation, how these talking points and messaging can really get us tripping if we're not careful. So thank you to all of our panelists for spending time with me and offering so much. Awesome. Before we go, I do want to give you some more information about all the things that the Campaign for Tobacco-Free Kids has to offer, and how you can get more involved if you, like myself, are so energized and motivated after such a rich conversation about how we can really go beyond pride. So we urge folks to get more information from the Campaign for Tobacco-Free Kids by checking out the link tree. It'll be in the chat, but it's also linktr.ee/CTFK. And there you can learn more about how to get involved and urge policymakers to take action to protect kids from tobacco in your area. And also you could share your own story. We've learned today how storytelling is so important, so you could share your own story. Because remember, together we can break down barriers, support one another, and foster a culture of emotional well-being, a culture of care, a culture of safety for all. Again, I'm Lincoln Mundy. I had the privilege of being your host for today's Campaign for the Culture. I want to thank all of our panelists and everyone of the partnerships team, the Campaign for the Tobacco-Free Culture, for having me. And if you have questions or want to get more involved, make sure to reach out to the partnerships at Campaign for Tobacco-Free Kids email, which is partnerships@tobaccofreekids.org, and it's right below me. So without further ado, thank you for tuning in.